Hello and welcome to the news hour at Haske-Tv. My name is Haske with the bulletin. Thanks for joining us. The management of the Federal Medical Center Jalingo has addressed recent public concerns over its mandatory medical admission pack, explaining that the policy is intended to enhance patient care rather than serve as a revenue-generating measure. The report.
The management of the Federal Medical Center Jalingo has responded to growing public outrage over its compulsory medical admission pack, stating that the policy is designed to improve patient care and not to generate revenue.
This innovation is patient-centered. It's not a revenue-generating strategy, because if you look at the consumables, the equipment, and even the drugs that are in this pack, when you analyze the prices from what we get in an open market, you compare with what the FMC is giving this pack, you know that it's not a profit-generating issue. FMC is a public hospital. We are charged with the responsibility of providing health care to people, training of medical students, doctors, or other healthcare workers that are specializing in the area of practice, and we are given the mandate of conducting research in healthcare. These are the three mandates given to a federal tertiary institution like ours. So we are not a profit-generating firm. So we are not paying attention to profit. What we are paying attention to is putting measures in place to ensure that we maintain services.
Speaking in an exclusive interview with Haske Television, the acting head of clinical services, Dr. Suleiman Abubakar Karim, said the hospital is not in crisis, explaining that the admission pack ensures essential medical supplies are readily available, reducing delays in treatment. He, however, admitted that communication about the policy could have been improved.
Especially the recent innovation of packaging our services into what we call a pack system. And there is a particular one that people are recently complaining about, especially the admission pack. This pack, in pack system, there are all the services who will pack them together. If your service require seeing a doctor, we give you what we call a consultation pack. And then if you require attention in the accident of an emergency, we give you what we call accident and emergency pack. If you are coming with a wound, laceration, that will require suturing, we give you what we call suturing pack. If a wound will require dressing, we give you what we call dressing pack. If your health condition will require surgical intervention, depending on the type of surgery, if it is an appendix, we give you what we call appendectomy pack. If it is hernia, we give you what we call herniorrhapy pack. And what that pack means, we package all those things that are required to enable seamless administration of that service. Take, for example, the admission pack you are talking about. Somebody coming for admission will require certain consumables, will require certain things that will be used in administration of drugs, and then will require certain drugs. So all these things are packed together into a single bag that we call admission pack. The essence of the consumable is to be used on the patient to maintain some level of sanity around him or the environment he stays.
Dr. Krim dismissed claims that the initiative is profit-driven, assuring that patient welfare remains a top priority. He added that emergency care will not be denied to patients who cannot afford the pack, while measures are being considered to support vulnerable individuals.
For patients that cannot afford the pack, is to invite what we call medical social services department. They are there. We invite them, they interact with this patient, and they are to get the pack on their behalf to see how the patient, if they can source some money before they are discharged, to pay. If they cannot, the medical social services have their means of getting the money back to the hospital. There is what we call Friends of the Hospital Committee, who are moving around to solicit for funds to be kept in the Friends of the Hospital post to set out bills for indigent patients. These measures are available. So it's not that if patient doesn't have the means of acquiring PAC, the patient will not benefit from the services in the hospital. That is not true.
On the rising cost of oxygen and allegations of delayed response by staff, he attributed the challenges to external factors and isolated incidents, while reaffirming the hospital's commitment to improving service delivery and maintaining quality health care for residents of Taraba State.
So the rise in cost of oxygen that you are saying of FMC Jalingo is not specific to FMC Jalingo because of the variation in prices of things in the open market. Production of oxygen requires the use of electricity. The tariff for electricity has changed. Production of oxygen requires sometimes the use of AGO or the diesel. The cost of diesel has changed. Oxygen is produced using a machine. That machine is a capital-intensive machine, very expensive. The cost has changed. Even maintaining that machine, we don't have a single person in the whole of Jalingo that can service oxygen plants we have in Jalingo. Yes, you have to hire people from Abuja, from Kaduna, from Lagos. And in most cases, you have to book for like 2-3 months to get these people to come. And you have to pay money for them to come. So when you look at these factors, what we are using to produce oxygen in 2 cylinders in 2013, for example, now in 2023, for example, now that we are in 2026, the amount will not even be enough to produce even a half of cylinder of oxygen because of variation in cost of electricity, cost of diesel, the component of the machine, the maintenance of the machine, and even there are gadgets we use in administering this oxygen. There is something that regulates the flow of the oxygen, the gauge meter, the flow meter. The prices in market has changed. There is a tube that conduct the oxygen from the cylinder onto the patient. The price has changed, and that is why there is a slight price variation. And the price is changing depending on the prevailing market circumstances in terms of the cost of those items I mentioned. Initially, the cost of oxygen in FMC Jalingo, it used to be like per day, when it used to be like 6,150 naira, I think. Though I was confronted by some pressmen, they said, someone on the social media, and they said it used to be 12,000 naira per day. There has never been a time that we charge.
Ahmed Abubakar, Haske-Tv News.
President Bola Tinubu has invited Plateau State Governor Caleb Mutfwang to Abuja for high-level talk following the recent attack in Angwan Bukuba just north. The Minister of Information, Muhammad Idris, disclosed this during a press briefing where he confirmed that the death toll has reached to 28. He said the president has extended condolences to the victims and their families, assuring that efforts are underway to restore peace. According to him, the federal government is working closely with security agencies and the Plateau State government to stabilize the area and investigate the incident. President Tinubu had earlier condemned attacks in Plateau and Kaduna State, describing them as barbaric and vowing that those responsible will be brought to justice. The chairman of the Independent National Electoral Commission, Josh Amopitan, has called for stronger legal frameworks to address emerging challenges in Nigeria's digital space. He made the call at the 47th Founders Day lecture of the Nigerian Institute of Advanced Legal Studies held at the University of Lagos. Speaking on the theme of civic participation and governance in digital era, Amopitan warned that while technology is transforming governance, it also poses risks such as misinformation and manipulation. He stressed that innovation must be matched with effective regulation to protect democratic processes. In a keynote address, Mayor Yaki also highlighted the importance of civic engagement, cautioning that unregulated technology could undermine democracy. The event brought together legal experts and policymakers to discuss strengthening the rule of law and accountability in Nigeria's digital age. Let's take a very short break. When we return, the news will continue. Please stay with us. Welcome back from that short break. If you are just joining us, this is Haske-Tv News with me, Farida Haq. Now the news continues. The Central Bank of Nigeria has announced the successful conclusion of its banking sector recapitalization program launched in March 2024. In a statement issued in Abuja, the Apex Bank said Nigerian banks raised a total of 4.65 trillion in new capital over a 24-month period, boosting the resilience of the financial system. The statement, signed by Olubukulo Okinwonbi and Hakamasi Ali, noted that stronger participation from both local and international investors. According to the CBN, 72.55% of the capital was sourced domestically, while 27.45% came from international market, reflecting sustained investor confidence. The bank also confirmed that 33 financial institutions met the new minimum capital requirement, with the sector maintaining capital adequacy ratios above global benchmarks. The Nigerian Army has reaffirmed its commitment to improving the welfare and financial security of its personnel. Speaking at a sensitization lecture in Kaduna State, the Director General of the Nigerian Army Finance Corporation, Julius Osifo, said the initiative is aimed at increasing awareness of welfare programs among officers and soldiers. He noted that the effort, directed by the Chief of Army Staff Waidu Shaibu, is part of ongoing reforms to strengthen the force. According to him, the programs include insurance coverage, soft loans, and expanded financial services for personnel, veterans, and host communities. The Army says the move is part of broader efforts to build a more professional, resilient, and combat-ready force. That has been the news on Haske Television. On behalf of the production crew, my name is Farida Haq, thanking you for staying with us.